There we go, you can have your finger back now.
Thanks.
Michael, it's really good that all your tests are stable, your CAT score's stable, or your blood tests are stable. It's really good to see that you're looking after yourself. Michael is visiting the practice today to review his chronic disease management plan. After my initial assessment, I checked with him to see if there were any other concerns. At these appointments, aside from checking out what's happening with your body, we also like to give you the opportunity to tell us what's concerning you so we can help with that. So is there anything concerning you?
I must have been a little worried about what happens if something at home happens. What does she do? Ring an ambulance? I don't know if I really want that. I would like to stay away from hospitals as long as I can. But then, if I get seriously ill, is it going to be too much for her?
I can understand why you'd be concerned about that. Some things we can do. We can put you in touch with some community services, some palliative care or some home nursing services that might be able to help you at home.
No, I don't think we need that yet. No.
I can understand that. But what about if you did fall? What would happen?
I don't know.
Something you could be thinking about now would be someone who could speak on your behalf if you couldn't speak for yourself.
Well, wouldn't they just ask me?
Yeah, they probably would. But you need to know what's important to Michael, what sorts of decisions you'd be making on his behalf.
We've talked about that.
That's really fantastic. So Sherry would know what you'd want if you did collapse and if you did need to go to hospital?
Well, we haven't really talked in that detail yet because, we don't know what's going to happen.
Yeah, it's hard to know what's happening in the future. None of us have got a crystal ball. Mine's broken. It is important to have a chat about that. It's important for us to know what you would want so we could act on your behalf.
Right.
So you've already obviously started the process. You're thinking about it, and that's the first step. The next step is to talk with someone about it. You've started talking with Cherry. Yeah. That's really great. The next part of the process would be to formally appoint that decision maker, someone who could speak on your behalf if you couldn't speak for yourself, someone who's confident, who knows what you would want. Mm-hmm. Yeah. The next part of the process is to write it down, writing down what your wishes would be if you couldn't speak for yourself, so we can all work off that same page, and then sharing it with the healthcare team, so with the hospitals, with anyone else who's caring for you. It's not written in concrete, it can change as things change for you at home, as your health changes. So what we can do for you today is to give you some information to take away, maybe a form to fill in. You can think about it and have a chat with each other. I can record it in your notes so that you can bring it up with the doctor next time you're here. Would that be okay?
Yeah, that sounds good.
Yeah, that'd be great.
It does sound good. Yeah.
Some weeks have now passed and Michael has returned to request a script. The nurse had mentioned to me about Michael's concerns and that she had brought up the topic of advanced care planning. It was important that I continue the conversation because these decisions need to be talked through over time. I see from the notes that Mary made that you were speaking to her about making an advanced care plan?
Yes. We decided Cherry would be my decision maker and say if I collapse at home, she'll call an ambulance. But she's not going to allow the doctors to put breathing tubes in.
Right. So did you appoint Cherry as your decision maker?
Yes, I did. Actually, I've got the form here. Is that okay?
Okay. Yeah, this looks like it. Is it okay if we keep a copy here?
Oh, of course.
So have you and Cherry had a chance to talk about what you would value most, so that it might help guide her to make her decisions?
Well, she knows I don't want the breathing tubes in. What else should we be thinking about?
Well, it might be a good idea perhaps to get all three of us to make a time to get together to talk through some of this.
Right.
I can discuss some potential outcomes with you and then you can let me know what you might decide. At the next visit, we discussed Michael's values and preferences for care and completed all relevant documents. The instructions included that he didn't want intubation, but did want IV antibiotics. A copy was included in our practice records.
It's now 6 months later. Due to a chest infection, Michael's health has deteriorated further. Recently, an ambulance was called to Michael's home. He was having trouble breathing, and Cherry and Michael decided to make the call to take him to hospital. He's now recovering, things are looking okay, but what's really worrying Michael is if Cherry can continue to manage his care. How's Cherry going?
She's okay. I mean, she's well, but being my carer and being responsible for the decision making, it's all getting a bit too much for her, I think.
Oh, okay. Have you spoken to her about it?
No, but I'm much sicker than I was when I first asked her to be my decision maker.
Okay.
And I don't want to be a burden to her.
Right. Is there anyone else in your family or anyone else that you would trust that could be an alternate decision maker?
Well, there's my daughter Jodie.
Yeah.
She's already doing a lot for us.
Oh.
But she may be willing to take on the decision making.
It sounds like it would be really beneficial for you if we sat down and had a look at all of your advanced care planning documents with you, Cherry, Jodie and your doctor, and just went through it all and ensured that it was all up to date, and that everyone sort of knew their roles and responsibilities and felt comfortable about what you wanted.
Right.
Is that something that you'd be happy for me to organise? Yeah.
That
Excellent.
sounds good.
Yeah, terrific. When it comes to having a conversation about advanced care planning, it's everyone's responsibility. It's important that you identify when advanced care planning is being considered. You then need to provide them with the information they need and support them to make their own decisions. Finally, support the team around you by communicating what a client might be thinking and noting when changes to someone's plan might be necessary.